Welcome to Easy Medicine channel. Today I discuss about the neonatal hypoglycemia. So let's start the topic. I think you all know about hypoglycemia. When blood glucose levels lower than normal, that is called hypoglycemia. In case of neonatal hypoglycemia, when blood glucose levels lower than 45 mg per dl, that called neonatal hypoglycemia. But in case of severe acute malnutrition, when blood glucose levels is lower than 45 mg per dl, that is called neonatal hypoglycemia. Now I shortly discuss about common cause of neonatal hypoglycemia. So the common causes of neonatal hypoglycemia are inadequate substrate, second hyperinsulinemia, third other sickness. So, in case of preterm, low birth weight baby, intrauterine growth retardation and small for gestational age, in that case, the babies are not able to store, neonates are not able to store glycogen appropriately, and they also impair ability to generate glycogen through the gluconeogenesis. So, hypoglycemia can occur. Second, in case of large for gestational age baby, an infant with diabetic mother are at higher risk for developing hypoglycemic child, because during pregnancy the fetus exposed to mother high blood glucose levels and produce more insulin to regulate this glucose, so develop hyperinsulinemia. But after birth, when the continuous supply of glucose from the mother stops, the infant high insulin level can causes blood sugar to drop too low, so for that it can causes neonatal hypoglycemia. Third, under other sickness, sepsis, birth asphyxia and hypothermia also cause neonatal hypoglycemia. I think you all are understood why the neonatal hypoglycemia occurred. Now I discuss the clinical feature of neonatal hypoglycemia, that are lethargy, that means decreased activity. Next, poor feeding, bradycardia, apnea, hypothermia, jitteriness, mean nervousness, and last, seizure. Next, I discuss in case of neonate when we monitor the blood glucose levels. So first, after birth, we should monitor blood glucose level. Next, at 2 hours, 6 hours, 12 hours, 24 hours, 36 hours, 48 hours, and last 72 hours, we should monitor the blood glucose level. In case of TPN, we should monitor blood glucose level every 6 hourly. For blood glucose monitoring, in case of neonate, we should use dipstick method and also use glucometer. A most important thing is when we use glucometer for draw blood, always we pick neonates posterior part of sole from lateral border. Never pick from posterior most part of heel, superficial calcaneum bone, because it can cause osteochondritis. What is osteochondritis? Osteochondritis is a small pieces of bone die due to insufficient blood supply. And always remember, depth of heel peak is 2.4 mm. Next, I discuss the most important thing, that is management of neonatal hypoglycemia. So, through a flowchart, I will be discuss the management of neonatal hypoglycemia. It will be easy for all. So, if the newborn blood glucose level for less than 45 mg per dl but greater than 20 mg per dl, that is asymptomatic. In that case, we advise mother to continue breastfeeding. And after 1 hour, we should check random blood glucose level, and if it is greater than 45 mg per dl, in that case we advise mother to continue breastfeeding. We also supervise breastfeeding, and we should monitor random blood glucose level 6 hourly up to 48 hours. But if the baby blood glucose level less than 20 mg per dl and baby is symptomatic, in that case now we give IV glucose, that is 2 ml per kg 10% glucose up to 24 to 48 hours. Next we start IV fluid according to glucose filtration rate. First we use IV bolus. Next we use IV fluid. In case of neonatal hypoglycemia, we use the glucose filtration rate is 6 mg per kg per minute. After 1 hour, if the blood glucose levels less than 45 mg per dl, we gradually increase to mg per kg per minute. If the blood glucose level is maintained, we should monitor blood glucose level every 6 to 8 hours up to 48 hours. There is a important thing, we gradually increase to mg per kg per minute up to 12 mg per kg per minute. If need more than that, we use central line. That is most important thing we should remember. Now I back to the first type of neonatal hypoglycemia, when the newborn blood glucose levels less than 45 mg but greater than 20 mg per dl and baby is asymptomatic. In that case, advise mother to continue breastfeeding, and after 1 hour, if random blood glucose level is greater than 45 mg per kg, then advise mother to continue breastfeeding, supervise the breastfeeding and monitor random blood glucose level 6 hourly up to 48 hours. But if after 1 hour the random blood glucose level is less than 45 mg per dl, in that case we should give IV fluid according to glucose infusion rate. So I think you all are understood about the neonatal hypoglycemia. So these are all about neonatal hypoglycemia. Here I end my topic, and if you like it and if you understand well, please share and subscribe my channel. Thank you.